You know, that feeling, that knot in your stomach, the worry. And then you get to the emergency room and it's chaos, a sea of people.
Oh, absolutely. The noise, the waiting, it's incredibly stressful, especially when you're already dealing with whatever brought you there.
Yeah, it feels like one of the most anxiety-inducing places you can be.
It really does. You feel kind of powerless, trying to figure out what's happening, when you'll be seen.
Exactly. And that's precisely why we wanted to do this deep dive. We've gone through a whole bunch of source materials, articles, notes, info on healthcare quality groups to really understand it.
Trying to unpack why ERs get so crowded, how the system actually works, and maybe most importantly, what you can do.
Right. How you can navigate that wait a bit better.
Yeah. So our goal here is to pull out the key insights, give you a sort of shortcut to being prepared if you find yourself in that situation.
Okay, let's jump in. So the big question first, why? Why are emergency rooms so often completely packed? What did the sources say?
Well, there were a few big reasons that kept coming up. The most obvious is just high patient volume.
Like flu season or something.
Exactly. Seasonal spikes, like flu or other outbreaks, depending on the region, can just swamp the system. Suddenly, everyone needs care at once.
Okay, so sheer numbers. But it's not just that, is it? It's also about the hospital's own limits.
Precisely. Limited staff is a huge one,
Mm.
especially nights or weekends, holidays, fewer doctors, fewer nurses, less support staff.
So even if there are beds, there aren't enough people.
Right. It creates bottlenecks. And another thing the sources pointed to is people using the ER for things that aren't true emergencies.
Ah, yeah, I've heard about that.
It puts a major strain on the system.
Yeah.
Someone comes in with, say, a cold they've had for days, something a regular doctor or an urgent care could handle.
They end up adding to the wait times for everyone else.
Exactly. Ties up staff, ties up assessment rooms. And then even when you are inside the ER, there are internal delays too.
Like,
Waiting for test results. Labs, x-rays, CT scans. That all takes time. Or maybe you need a specialist to come down and see you.
or waiting for a bed upstairs, right? Like in the main hospital.
That's a big one. Waiting for an ICU bed or just a regular inpatient bed to open up. All these things keep patients physically in the ER space longer, which keeps the waiting room full.
Okay, so it's a mix of high demand, staffing limits, maybe some inappropriate use, and then these internal hospital log jams. So how do they decide who gets seen first in all that chaos? This is where triage comes in, isn't it?
Yes, triage is absolutely fundamental. The sources make that very clear. It's the system they use to prioritize.
And it's not first come, first served?
Definitely not.
Yeah.
It's based purely on the severity of your condition, how sick or injured you are. The goal is to get the most critical, life-threatening cases seen immediately.
So can you walk us through those levels or codes the sources mention, like code red?
Right. So at the top, you have the critical cases, code red, sometimes called level 1. These are things like active heart attacks, strokes, major trauma, someone who can't breathe.
Those people go straight back.
Immediately. There's essentially zero wait for them. They need life-saving care right now.
Okay. What about stuff that's serious but maybe not immediately life or death?
That's the next tier down. Moderate cases, maybe code yellow or levels 2 or 3. Think high fever, maybe bad dehydration, a broken bone, but stable, severe pain.
So they still need prompt attention.
Yes, definitely prompt. But if the ER is slammed with level 1s, you might still have a wait. You're prioritized over less urgent cases, though.
And then there's everyone else, the code green people.
Often, yeah. Levels 4 and 5 or code green. These are the non-urgent conditions. Minor cuts, sprains, colds, things that can wait.
And that's where the really long waits happen?
That's typically where you see the hours-long waits in a crowded ER. They have to clear the higher acuity patients first.
So that explains why you can feel absolutely miserable. Maybe you even do need to be admitted eventually, but you still sit in the waiting room for a long time.
Exactly. If you're triaged as, say, a level 3, you're waiting behind any level 1s and 2s who are actively being treated or assessed. Plus, remember those internal delays.
Right, waiting for tests or beds.
Yeah, so even if a critical patient is stabilized, they might still be physically occupying an ER bed while waiting for that next step, keeping things backed up. It's a complex flow.
Okay, understanding the why, the triage, the backups, that helps manage expectations. But what can you actually do when you're the one waiting? The sources had some, well, surprisingly practical advice.
They did. And the first one sounds almost too simple, but it's crucial. Try to stay calm. Be patient.
Easier said than done sometimes.
Oh, absolutely. But the sources suggest panic or getting angry. It doesn't help. It actually makes it harder to think clearly and, importantly, communicate effectively with the staff.
Ah, communication. That's key, you said.
Absolutely vital. When you first talk to that triage nurse or the registration desk, be clear, be concise.
Don't downplay things, but don't exaggerate either.
Exactly. Be specific about your symptoms, especially the severity. Mention if anything is changing rapidly, and critically, tell them about any major pre-existing conditions, heart issues, diabetes, pregnancy, plus any allergies and all the medications you're currently taking.
That helps them assess your situation accurately.
Yes, it's vital for accurate triage.
And knowing about those triage levels we just discussed, that helps you understand the weight.
Right, knowing that the person who arrived after you might have gone back first because they're, a potential heart attack helps frame it.
It does. And the sources say it's okay to respectfully check in. If your condition gets worse, definitely tell someone immediately. Or even just for a polite update on wait times, though, keep your expectations realistic.
Preparation also seemed like a big theme in the notes we reviewed.
Huge. If you have even a little bit of time, or if it's something you can anticipate needing, getting documents ready helps enormously. Like what kind of documents?
A list of your current medications dosages, too, if you know them. Allergies, any major past medical history or surgeries, your insurance card, government ID, and emergency contacts.
Having that ready saves time during registration and assessment.
Big time. And another point the source is really stressed, considering alternatives if it's not a critical emergency.
If the ER is packed and your issue is maybe less severe.
Exactly. That sprained ankle, that nagging cough, that minor rash, maybe an urgent care center, a polyclinic, or even a telehealth call could be a much faster option.
And it frees up the ER for the truly critical cases.
Right. It's better for you, potentially, and better for the system overall.
Any other sort of practical tips for managing the wait itself?
Yeah, a couple. If you're there with family or friends, maybe designate one person to be the main point of contact with staff. Stops multiple people asking the same thing.
Good idea. Reduces the noise for the staff.
And, basic comfort things. A phone charger is always good. Maybe water or a small snack if it's okay for the patient's condition. Always check first. If possible, and with permission, maybe waiting in a slightly quieter area than the main waiting room.
Okay, so that's what to do. But the sources also highlighted some things you definitely should not do in a crowded ER, things that are counterproductive.
Yeah, this is important. Things to actively avoid because they can actually make things worse, maybe even slow down your own care.
What's number one on the don't list?
Don't yell at the staff. Don't blame them. Don't pressure them. It's tempting when you're stressed and waiting, but they're juggling emergencies under huge pressure.
It doesn't actually speed things up.
No, it does the opposite. It hinders communication, adds stress, and can distract them. Also, try not to physically crowd the place.
Like hanging around the nurse's station.
Yeah, exactly. Or hovering near the doors to the treatment areas. Give them space to work. It's a busy, high-traffic area.
What about exaggerating symptoms, trying to get seen faster? I've heard people suggest that.
The sources strongly caution against that. Don't do it. Healthcare staff are trained assessors. Trying to game this system by exaggerating can lead to the wrong tests, wrong initial treatment, and it wastes resources needed for people who are genuinely critically ill. Be honest and accurate.
Makes sense. And what if you just get fed up and decide to leave after waiting?
Definitely don't just walk out without telling anyone, especially if you've already been triaged or registered.
Why is that?
Well, for your own safety, maybe they started some tests or have results or need to give you instructions. And also for the hospital, they need to know you've left so they aren't still trying to track you down or hold a potential spot. Always inform the desk or a nurse if you decide to leave against advice.
Okay, shifting slightly. Are there any sort of better or worse times to go to the ER, assuming you have any choice in the matter?
Yeah, the sources did touch on that. If your condition isn't a sudden dire emergency, but you still feel it needs ER evaluation, timing can sometimes make a difference.
When tends to be less busy?
Generally, weekday mornings to early evenings seem to be a bit less chaotic than, say, overnight, weekends, or public holidays.
That makes sense. Aligns with when GP offices are closed and maybe staffing is lower.
Exactly. And related to that preparation point earlier, having a little go bag ready can be helpful, especially if you have a chronic condition that might land you in the ER sometimes.
What would be in that?
Just the basics. That document list we mentioned, phone charger, maybe a book or something to pass the time, a water bottle, a snack if it's okay for you. Small things that just make a long wait a bit more bearable.
It's easy to get caught up in the immediate stress of the ER visit itself. But our sources also pointed towards the bigger picture, the systems working behind the scenes on quality and safety. How do organizations like JCI or NABH fit in?
Right. This is about the ongoing effort to improve the very systems that get stressed during dizzy times. While these organizations don't magically empty a waiting room, they set standards that hospitals aim to meet.
JCI, that's Joint Commission International. And NABH.
Yes. JCI is global, works in many countries, setting really rigorous standards for everything from how patients are identified to medication safety to surgical procedures. They have specific international patient safety goals.
Goals like improving communication between staff.
Exactly. Things like that, preventing errors. Their whole mission, as the sources frame it, is about pushing for the highest standards of healthcare quality and patient safety.
And NABH does something similar, but specifically in India.
Correct. NABH is part of India's Quality Council and sets the benchmarks and runs accreditation programs for healthcare organizations within India, again, focusing on processes, patient care, safety, continuous improvement.
So how do hospitals actually put these complex standards into practice? I think you mentioned consultants like Supreme Medic.
Yeah, firms like that specialize in helping hospitals navigate this. They help implement the quality management systems needed for accreditation, like NABH. They might assist with planning, staff training, streamlining workflows, documentation, all the nuts and bolts.
So even while you're sitting there in that crowded waiting room feeling frustrated, there are these bigger forces at play. These organizations, these standards, these consultants, all working to make the underlying processes safer and more efficient.
That's the idea. The sources suggest that going through accreditation isn't just about getting a certificate. It can be a significant process for the hospital team itself.
How so?
It forces them to look closely at how they communicate, how different departments coordinate, like the ER with the labs or the inpatient wards, and how they standardize care. In theory, all of that should contribute to better patient flow and safer care over time, even when things get really busy. It's about building a framework for ongoing improvement.
Okay, let's try and summarize the key takeaways from this deep dive on getting through a crowded ER.
All right, first I'd say accept that ERs get crowded for many reasons, and getting seen instantly isn't always possible. Admission definitely isn't instant.
And understand that triage is the guiding principle. It prioritizes by severity how sick you are not when you arrived. Life-threatening comes first, always.
Right. And your own actions matter hugely. Being prepared with information, communicating clearly, and staying patient are your best tools.
Also, remember those alternatives. If it's not critical, urgent care or similar options might be much faster and more appropriate.
Definitely consider those. And finally, know that behind the scenes, there's a constant effort through organizations and accreditation standards to improve overall healthcare quality and safety, even within the challenging ER environment.
So maybe a final thought to leave everyone with from our dive into the sources. In that really stressful ER situation, you can't control the crowd. You can't control bed availability. But what you can influence is your own approach. Your preparation, your understanding of how the system works, your communication. That's actually where your power lies. It shifts you from just passively waiting to actively navigating your care.
That's a great way to put it, active navigation.
It really is. And, speaking of navigating the hospital, one source hinted at what happens after the ER chaos, the whole process of getting admitted to the hospital itself. That sounds like, well, maybe another deep dive for another time.
Could be fascinating. There's always another layer to peel back with these systems.
Indeed there is. For now, stay informed, try to stay calm if you find yourself there, and we'll connect with you on the next deep dive.